Well, thank you for joining us for our webinar, A Mindful Approach to Pain with Michelle Walz, MPT. I'm Riley O'Neill. I'm a patient care coordinator here and marketing manager at Heart of Wellness. Heart of Wellness is an interdisciplinary clinic located in Tumwater, Washington. We have 7 naturopathic physicians and a variety of specialty clinicians, including acupuncture, functional medicine, massage therapy, nutrition, and of course, physical therapy. We are proud to welcome Michelle to share her knowledge with you today. Following the presentation, and if time permits, Michelle will answer any questions. Although she can't go into specifics, she will do her best to answer questions to the best of her ability. Without further ado, let's take it away, Michelle.
All right. Thank you, everybody, for joining me today. I thought we would start this webinar today with a brief mindfulness practice, and then we'll move into what we'll be talking about today is learning a little bit more about how pain works in our bodies, and then learning a bit more about really what is mindfulness and how can it be helpful when it comes to our experience with pain. And then we'll finish with a little bit longer practice at the end, a mindful meditation. So we'll start by just getting comfortable. You are certainly welcome to close your eyes if you're comfortable with that. Or if you'd like, just soften your gaze a little bit. And take a few moments. I know that our days can get busy. Take a few moments letting go of the busyness it took to get you here. And for a few moments, letting go of your to-do list of what comes next. Just allowing yourself a few moments to settle into the present moment. Beginning with your breath. The presence that is open and curious, just begin by noticing your breath. Becoming aware of each breath in and each breath out. Allowing your breath to breathe itself, just simply noticing. If you find that your mind is a little bit busy with thoughts, it's really no big deal. Just inviting yourself back to noticing your breath in and your breath out. And as you continue to notice your breath, I'd like to share a short poem with you. The title of this poem is called Centering by Walz. Here, right now. Bring your mind to this place and time. Invite it, even if it resists, to sit and witness what it is to be alive. Let there be no ulterior motive in this moment, but to be. Rest on the waves of breath and choose to experience all of it. Let thoughts float through and leave again, as if the mind slowly settles like snow inside a shaken paperweight. This is all there is here, right here and now. Again, continuing to notice your breath with a presence that is kind and open. Perhaps softening the muscles of your jaw and your face. Allowing your shoulders to relax down away from your ears. And inviting a little bit of movement into your body, maybe wiggling your fingers and wiggling your toes. And if your eyes were closed, opening your eyes. And that was a real brief example of a mindful meditation focused on your breath. Like I said, we'll explore this a little bit more at the end of this presentation. Moving forward, I'm going to share my screen with you just real briefly here, show you a few things. So today's presentation will be about a mindful approach to pain. Pain is something that we've all experienced, some of us more than others. This is a topic that is near and dear to my heart, and there's a reason for that. Yes, I'm a physical therapist, so I work with people in pain, and I know the ins and outs, the physiology, the science, the background of how pain works. I'm also a yoga instructor, so I love to incorporate yoga, breath, mindful movement into treatment sessions. But why this is near and dear to my heart is I live with pain. I have been in chronic pain for many decades, and I've kind of been riding the waves, the ups and downs that go along with that. And I am very fortunate to have had some amazing teachers in my life. And the majority of what I'll present today is really things that I have learned along the way. They're not just personal experience, they're also things that are really supported by science. There's a lot of research out there and to support these techniques. And some of these techniques they're finding in research to be just as effective as medication. We have a whole host of our own internal pharmacy in our bodies. And again, the teacher I'm speaking of that has shared so many of these lovely things with me, her name is Carolyn McManus, who is also a physical therapist up in Seattle. And so I just feel it's appropriate to honor her right now, as many of these teachings have been passed on to me through her. So a mindful approach to pain. This is me. I'm Michelle. I'm a physical therapist. I've been a physical therapist for over 20 years. My training began in Rochester, Minnesota at the Mayo Clinic. And then along the way, I've really developed an interest in sort of a blend in Eastern and Western medicine, diving pretty deep into the practice of yoga, certified in radiant health yoga, therapeutic and accessible yoga. So that's just a little bit about me. Let's talk about pain a little bit more. This is a fairly recent definition of pain from the International Association for the Study of Pain. And it goes as follows: an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. It's very interesting in this definition. What we see is that it mentions it being a sensory and an emotional experience. Pain is both. It's complex. There's a lot that goes into the experience of pain. And at the end here, you see the words actual or potential tissue damage. What's new about this definition of pain is what we now know in pain science is you can have pain even though the tissues have healed. So pain can persist in the absence of tissue damage. Here's more of a pictorial version of the old versus the new model of pain science. You can see on the left upper corner, there's a flame. Obviously, if you get your foot close to a flame, it's not going to feel great, right? And this picture really emphasizes how pain is there to protect us. Pain, we want to feel pain because it allows us to tend to our bodies for protection. So in this first model, you can see the red line moving up the spine to the brain. And this is the nerves in the foot sending a message to the spinal cord. And then the spinal cord sending a message to the brain. And that's how pain protects us. you will pull your foot away because your brain has determined this is an immediate threat that we need to tend to. So this is the old model of pain that really focused only on there being what we call a noxious stimulus or an unpleasant sensation or tissue damage driving this process of pain. What we now know is that this is not just a one-way street. You can think of the nerves in our body sort of like a highway. We have like 45 miles of nerves in our body, which is mind-blowing in itself. But they don't just travel in one direction. So we have, again, this flame and the nerves in the area sending a message to the spinal cord and then up to the brain. But what we now know is a lot goes into what happens at our brain once the signal arrives. Prior experiences factor into this experience. This would be the example of me with my lower back, where it's been very debilitating at times. In the past, prior to learning what I'm going to talk a little bit more about with mindfulness, it would be really scary. And I'd be like, oh no, here we go again. What if I can't get out of bed tomorrow, right? That fear or prior experiences that we tend to attach a story with our pain from what we've already experienced. And prior experiences can allow our bodies to get really good at pain. Meaning, if you picture this pathway like a road, you mentioned there are like 45 miles of nerves in our body. You could picture this road being traveled time and time again, instead of it being at first like maybe a bumpy dirt road. When we get good at pain, when pain persists for years and years, months, years, then that road becomes more like a paved highway. We can become more efficient with pain over time. The nerves, there's a saying that says nerves that fire together, wire together. So this pathway can become more efficient in time so that it takes less of, it might not take flames from a fire anymore. It might not take spraining your ankle. It might be the sensation of clothing rubbing on your skin. And your body misinterprets that because this pathway becomes a little too efficient for its own good. Other things that can play into our experience with pain would be attention and expectations surrounding the experience. And I'd really like to share this story, this study with you. This is fascinating stuff. The science behind this is really cool. This graph you're going to see here, this was an experiment where they looked at people's experience with pain. And they asked them on a pain scale. This pain scale goes up to 100. Usually when you go to the doctor's office, they say 0 to 10, right? Give me a number 0 to 10. So essentially this is like that, but it's 100 instead. So what they did is they used this heat sensor to people's calf muscles to create pain because they're studying pain. And they also at the same time put an IV in these people's arms with saline, right? It's not going to really have any benefit. It's just a saline drip, okay? And so they did this heat stimulus to people's calves and they said, how much pain are you in? Well, this is almost 70 out of 100, right? And over here, they asked people, how unpleasant is this sensation? And here's where they're starting. This is the baseline. What they found, I should say, this is the author of this study is Bingel, by the way, in 2011, Bingel, if you're curious to reference this. What they did is then they started a fast-acting opiate in that IV drip, and it's called remifentanil. It's a fast-acting, very efficient opiate to reduce pain. But they didn't tell the people, this is the kicker, they thought they were getting saline, right? And their pain went down a little bit. They didn't know about it. The next bar you see is when they actually told the people, you are receiving this fast-acting opiate that should really help you with your pain. Look at this, the pain went down, right? So this shows you they didn't know about it here, but they were already receiving the medicine. But now they know about the medicine and look at where the pain goes. Look at where the unpleasantness goes. It goes down quite a bit. So this is really kind of interesting. Now that they know they're getting the medication, it becomes more effective. And then this part is very interesting. This last bar that you see here, this is the pain levels again. It went right back up to where it started because they told the participants they were no longer getting this medicine. They said, oh, by the way, we stopped that pain relieving medicine. They lied. The pain medicine was still being delivered, but they told the patients that it was no longer being delivered. And look at this, the pain went right back up to where it started. So what this study was about was how expectations affect the efficacy of a drug, right? And this really illustrates nicely how our expectations can enter into our experience with pain. So again, they started here. When they knew they were getting the medicine, pain went down. And then they were still getting the medicine, but they didn't think they were. Their expectations completely eliminated any benefit of the drug. So there's expectations in pain, just a little brief snippet of that. So our mood can play into our experience with pain, anxiety, depression. What we know is if most of us, I can't see you, but I'm going to raise my hand. My pain is always worse when I'm stressed out or if I'm going through a stressful period in my life. It feeds our experience with pain. Most of us already know that because we've experienced it firsthand, but there's a lot of research to support this too. Or if you were injured and the injury happened in a very traumatic way, this can feed the experience with pain as well. And then there are structural changes that take place over time. I told you how these pathways can become more efficient. Also, we start processing pain in different areas of our brain. When we've been in pain for more than 3 months, our pain is not just processed in the part of our brain that tries to determine where this sensation is coming from, but it also starts to become processed in the emotional centers of our brain, primarily the fight or flight center, our amygdala. So that's a little bit about our old model of pain. We thought it was just, oh, there's always tissue damage creating pain. Now we know it's a little more complex than that. Yes, we can have this one pathway coming up, but the brain can act sort of like a volume control. The brain can say, you know what, I don't think this is very important, and can turn telling us, it's no big deal. It's just your shirt sleeve on your skin. Or the brain, if it feels like it's a threat, whether it is or not, it'll turn the volume way up to make this very important. So that's our model of pain and kind of how things work. I could go on and on about that all day, and I'm going to move myself forward from that. We can talk more about that another time. Where does mindfulness come into this picture? Mindfulness comes into this picture in how we respond to sensations in our body. There's a metaphor of 2 arrows. The first arrow being pain. Pain is unavoidable. We all will experience pain in our lives. And so that would be the first arrow. If you can imagine, an arrow hitting you, it's a pretty strong sensory experience, right? The second arrow is optional. And this is where we have more control. The second arrow is our reaction to the sensory experience. And this can be a physical reaction, cognitive, or emotional. What we find with experienced meditators is this second arrow is pretty much non-existent. They only experience, when we look at an experienced meditator, they only experience pain in the sensory processing part of their brain. There's no emotional attachment with that. And that's what we find in experienced meditators. The 2 arrows. So here we go. Pain is a sensation in our bodies. My teacher I mentioned earlier, Carolyn, she would say with her patients to start by eliminating the word pain from their vocabulary and just label it as sensation. So pain is a sensation coupled with our response. And this is where mindfulness comes into play. And there are numerous studies supporting mindfulness as an effective tool for pain management and reduction. And also, when you're in pain for a long time, it can create, in and of itself, can create more stress and anxiety in your life. And mindfulness is a great tool for that as well. I don't know if any of you follow NPR, but there was just a study that I've heard about before, but it was lovely to see it on NPR yesterday, talking about mindful meditation being just as effective as an anti-anxiety drug in an 8-week program. So there's some really awesome research out there supporting this. I love this picture. Really, a lot of us, we think about movement, we think about going to the gym and exercising our muscles. You can think of a mindfulness practice like training your nervous system, like lifting weights for your brain and for the nerves in your body, okay? This takes time, this takes practice. Most of us, we wouldn't expect to go to the gym on the first day and lift big, heavy weights. If we do, we might hurt ourselves, right? And the same thing is true of our nervous system. This can take time and practice. So I'll encourage you to really think about this as we practice and allowing yourself a little room for learning and not expecting to be super good at meditation. It's not something to be good at, it's something to practice. Okay, this is really cool. All right. I'm a scientist and, we just can't help but throw out these studies because I want you to know there is science to back these techniques up. This is cool. We really thought before, a lot of studies out there look at 8-week programs in mindfulness, okay? This is a study looking at training people in mindful meditation for 4 days. 4 days, 20 minutes each. What is that? That's 80 minutes. That's an hour and 20 minutes total of training. Okay, so 4 days of training. Again, this was the heat sensor to a calf. And this study is by Zeidan, Z-E-I-D-A-N, Zeidan et al. In 2011. What they did is they looked at people's pain over here on the left. I'm sorry that this is missing. This is the visual analog scale of 0 to 10. 0 to 10. They asked people how much pain they're in. And then this is the first grouping. They asked how much pain they were in, and then they said, okay, pay attention to your breath. And this is how much pain they were in. Then here's the 4 days in between, this blank area here, 4 days of training in mindful meditation. They did the same pain stimulus, the heat sensor to the calf muscle, and they asked them how much pain they were in. And then they said, okay, go ahead and practice that meditation we taught you, the mindful meditation. And look at this, the pain went down by 40%, just with 4 days training. And over here, we see the unpleasantness that's associated with pain. It went down by over 50%, 57% reduction in pain, just by practicing mindful meditation. So again, we used to think it was experienced meditators. We knew that they had a higher pain threshold or a higher pain tolerance. But here what we're seeing is in short of 4 sessions of learning mindfulness, a 57% reduction in the unpleasantness associated with this heat stimulus to their calf. So this is good stuff, right? We're starting to see, okay, science is backing this up. Good stuff. So this is where I'm going to just talk a little bit about what is mindfulness and how can we practice this in our lives. I have a few definitions up here. Jon Kabat-Zinn, if you're not familiar, he is, I would say, probably the father of mindfulness in the Western medical community. His definition of mindfulness would be awareness that arises through paying attention on purpose in the present moment and non-judgmental. Here's Scott Bishop, who's a psychologist that defines mindfulness as non-elaborative, non-judgmental, present-centered awareness in which each thought, feeling, and sensation that arises is acknowledged and accepted as is. Merriam-Webster dictionary says, the practice of maintaining a non-judgmental state of heightened or complete awareness of one's thoughts, emotions, or experiences on a moment-to-moment basis. That's a kind of a glimpse or a snapshot of what is mindfulness. So again, it's this present moment awareness, and it's awareness and this presence that is open and kind and curious, allowing what's there to be. And this is very useful in our experience with pain. We tend to want to push away things that are uncomfortable or unpleasant sensations and really hold tightly to the things that are pleasant. And in a mindful practice, we start to allow whatever is there to be without resistance. Here are a few qualities. Thinking of being curious, patient, kind, non-judgmental, accepting, open. And up here, you'll see the words beginner's mind. This is really important. We can be really hard on ourselves, especially in a meditation practice. I've heard from so many people over the years, they've come to me and they've said, Michelle, I've tried meditation. I'm no good at it. And this is a reminder that it's not something to be good at. It's something to practice, okay? We have brains. What do brains do? They think, they process, right? So when we sit in meditation, sometimes, I've been meditating for years, and there are still times in meditation when I'm planning my Safeway grocery list, right? That's just, our minds can be busy. The key to the practice is acknowledging that. So as we're practicing together later in the session and you find your mind being busy, be kind to yourself and just notice those thoughts. And you might even label it, oh, thinking, and just kind of letting it pass through like a cloud in the sky. So beginner's mind, allow yourself to be a little, not to be good at something, just to practice, continue practicing. So these are some qualities and many words that I really like that really really summarize a mindfulness practice in sensing your body, allowing, attending to, observing. And we notice, observing and allowing a sensation to be in our body without trying to push it away and resist. Okay, let's see here. So, can you still see me? I hope so.
Yes.
Okay, awesome. All right. So slow, deep breathing. I thought this would be useful. The type of meditation we'll be practicing today is a breath-centered meditation. And our breath can be very powerful. You've probably heard of belly breathing or diaphragmatic breathing. I'd like to just show you this picture of this is what the diaphragm looks like in our bodies. It covers a lot of territory. And as you breathe in, what occurs is this diaphragm drops down and it allows this area of your ribs to open up and your belly to expand. Okay. So this is what the diaphragm looks like. You can see how it's nestled in here in your body. It even, notice, has some attachments to our spine. So being able to take a full diaphragmatic breath is very healthy for our spines. And just in and of itself, even taking away the piece of mindfulness right now, studies have also supported a reduction in pain and improved regulation of our nervous system just through slow and relaxed, deep breathing. And so I like this visual of the Hoberman sphere, if you've seen these before. This would be our breath out where things sort of condense back to the center. And when you breathe in, you can sort of imagine as your diaphragm is allowing this expansion in your body in three-dimensionally. We are three-dimensional beings, right? So our ribs can open up to the sides. Our ribs can expand in the back side of our body and in the front side of our body. This picture here, you may choose today, if you're a very experiential person and you it's a challenge for you to really feel what's going on inside your body when it comes to your breath, you might literally place your hands on your chest and your belly so that you can feel your breath under your hands. So slow, deep breathing in and of itself can be very beneficial when it comes to our experience with pain. Here's this visual. I like to have you watch this video with me, and then you can see and just follow along with this video, working a little bit with our breath. Making yourself comfortable, sitting in a relaxed yet upright posture. We'll begin this video. And what you'll find is this opening of this triangle, right, into like a shape, a sphere, and then back down as it comes down. That'd be our breath out. This would be our breath in. And then your breath out. So take a few moments. This is 1 minute long, just watching and allowing yourself as you breathe in to feel that expansion three-dimensionally into your ribs and your belly. And as you exhale, a softening, a releasing, a condensing. Breathing in, allowing that expansion. And breathing out as you release. Okay, so that was about 1 minute. It's a good place to start. I also included this video to remind you that any little bit helps. If you find you are unable at this time to set aside a lot of time for your breath and for meditation, even just a few short moments of mindful breath, being aware of your breath, can be beneficial and can help soothe your nervous system. There are a lot of these out there on YouTube, so you might poke around a little bit and see what you can find if you like that visual. So let's take a few moments to expand on that breath. Making yourself comfortable. If you're sitting in a relaxed but upright posture, or you might be lying down if that's more comfortable for you. You're welcome to close your eyes, or if you'd prefer, you can just soften your gaze a bit, taking your gaze down. And allowing yourself for a few moments just to be curious and observe your breath. Becoming aware of each breath in and each breath out. Being curious about what your breath feels like in your body. Perhaps you notice a subtle rise and fall of your belly. Or a subtle rise and fall of your chest, your rib cage. Again, just allowing your breath to breathe on its own. Taking a few moments to simply notice. If you find yourself distracted by thoughts or sound, it's no big deal. Just allow those thoughts to drift by, just like a cloud in the sky. And with kindness, inviting your attention back to your breath. Just simply breathing in and breathing out. And letting your breath go for now. Inviting your awareness to move down into your feet. Being curious about the sensations that you notice in your feet. Perhaps you notice what it feels like to have your feet contacting the floor, that sense of steadiness. Or maybe you're aware of temperature, tingling. Again, with a kind and open, a curious presence, just allowing yourself to notice, becoming aware of sensation in your feet. And maybe you don't really feel much at all, and that's okay too. Just allowing whatever is there to be. And letting that go. Bringing your awareness to your hands. Being curious about any sensations that you're aware of. Again, it may be temperature, or perhaps it's the sensation of your hands resting in your lap. Being curious and open. And again, letting that go for now, bringing your awareness to your sit bones and the back of your thighs, making contact with your chair. A sense of steadiness. And allowing with your next breath in, your spine to feel light. Space between each vertebrae. Almost as if the crown of your head is moving a little closer towards the ceiling. Again, this posture that is upright yet relaxed. And coming back to observing your breath. Becoming aware of each breath in and each breath out. Just simply noticing. And when you're ready, inviting a little bit of movement into your body, maybe wiggling your fingers and wiggling your toes. And when you're ready, opening your eyes if they were closed. And that was a brief example of a mindful meditation, really with the majority of your awareness being on the breath. Our breath, as bringing our awareness to our breath, is very practical, because really your breath goes with you wherever you go. So this is a practice you can infuse into your day easily. You might find you're annoyed, you're stuck at a stoplight. Turn that into an opportunity for a moment of mindfulness. This one, keep your eyes open at the stoplights. You know when it turns green, right? But that can be a fairly, feel like a long time sometimes. So this could be a really great opportunity to practice just noticing your breath for those few moments. So a stoplight breath. Hand washing, that would be another opportunity, especially as we go into, we've been there for a while, but a season of some viruses floating around, right? We tend to wash our hands a lot more. So hand washing can be an opportunity to practice mindfulness. As you wash your hands, you might pause, really letting go of whatever you need to do next after you wash your hands. And just for those few moments, be fully present with that experience. Noticing the sensation of the soap and the warm water on your hands. You might even watch your hands rubbing together so you're fully immersed in that experience with the sense of your vision as well as touch. And giving yourself permission just to be fully present. We can practice mindful eating, maybe setting down your phone instead of watching TV or looking at your phone while you eat. Maybe once a week, you might have a mindful meal where you're just appreciating the textures, the taste, the smell, the colors of your food. Mindful walking, instead of being focused on getting from point A to point B in the fastest amount of time possible, might slow our walk down for just a short bit. And during that portion of your walking, literally just noticing the sensation of your foot contacting the ground. Maybe pausing, taking a few intentional breaths. So we can infuse mindfulness into walking. And then we can move our bodies in a formal yoga practice, or maybe just an informal practice of moving mindfully. Anything that you already do as far as exercises go. It could be as simple as breathing in as your shoulders come up towards your ears and breathing out as you roll your shoulders down and back. So each movement that you perform, whether it's lifting your arm or lifting your leg, you could just use your breath along with the movement. Maybe when you lift your arm, you breathe in, and when you lower it down, you breathe out. Or if you're lifting your leg, breathing in as you lift it, breathing out as you lower it. Get the idea? It's just infusing a little bit of breath with your movement. That would be an informal practice of mindful movement. And then there's also the formal practice of yoga, which runs much deeper than just I think in our Western culture, we've really hooked into fancy postures and bending our bodies in a certain way. And really the intent of those postures is to open our bodies and to free the energy in our bodies so that we can connect with ourselves, connect with our bodies with kindness. So there are a lot of parallels there with what I talked about earlier in a mindful practice. So to summarize what we talked about today, pain is complex. Pain is more than just a physical sensation. It's coupled with our response. And there's a whole network of things that's going on in our nervous system when we experience a sensation in our bodies. And a mindfulness practice, again, sort of uncouples the emotional aspect of pain, the fear, the anxiety that comes along with that sometimes, and allows us to experience a sensation for what it is, as simply a sensation. And what we know again is that we can start to affect our experience with pain in a very short amount of time as a new practitioner of mindfulness. When you're even new to these things, in a few short days, we can see a reduction in pain. And the main reason being is this: because a mindful practice, because our breath has a soothing effect on our nervous system. And it also helps us to step back. And instead of the part of our brain that's the fight or flight, the fear-based part of our brain taking over, we're able to sit back and access the more logical part of our brains, When we soothe our nervous system, we have access to the logical part of our brain that can go, oh, that's an interesting sensation, rather than, oh no, oh great, something must be really wrong. I'm not going to be able to get out of bed again tomorrow, right? There's a big difference in how we approach our experience with pain. Okay, I think I have gone on for long enough. I hope that just a little bit of this in some way is helpful for you. Just knowing, number one, if you are in pain, you are not alone, okay? And also, there are a lot of remedies out there that really are a natural way to either, if you are on medication, to perhaps increase the efficacy of your medication because you're also accessing your own internal pharmacy. And also, we know that just by knowing a little bit more about how pain works, if we were to study your brains right now in an MRI, what we know from research is just by knowing a little bit more about how pain works in your body and how your nervous system works, already your pain signals would be less if we were to measure this in your brains. So there you go. I'm here at Heart of Wellness. Again, I'm a physical therapist. I am actively treating patients. So if this is something that piqued your interest and you are curious to learn more and really wanting a more personalized approach for your body, our contact information is below. We have our email. We're located in Tumwater, and here's our phone number. And also our website has a lot of information, and that would be heartofwellness.org. You can access a lot of educational materials at that website, and you can even schedule your appointments through the website, which is pretty convenient. Awesome. So we have just a few minutes left. I see there are a few chats here. I'm curious. Okay, so I see this first question here that said that their doctor told them that pain cannot continue more than 6 months. That is simply not to negate your doctor, but I guess I am. Pain is, you are the expert on your body. If you feel pain, there's pain, right? Nobody can tell you if you are experiencing pain or not, because they cannot feel what's going on in your body. And so this is something I like to really empower my patients with, is that you are the expert on your body. I cannot feel what's going on in your body, but you can. So absolutely, pain can persist for much longer than 6 months. All pain is real. If somebody's told you otherwise, you can throw that out the window. Pain is real. All pain is real. Where it gets a little tricky is when doctors can't put a finger on it as to why. Maybe your scans come back clean. It's like, oh, well, we got rid of the cancer, or we did surgery on your knee, or we did surgery on your back. Your body parts are fixed. They shouldn't hurt anymore. And this is where, if we find that there is pain in the absence of tissue involvement, that's where the doctors are like, I don't know why you're still in pain. And this is when it comes back to the nervous system. The nervous system can become overly sensitized. Like I said, we can get really good at pain, and it's because our nervous system becomes more efficient, which isn't always a great thing, right? It gets really good at pain. And so the nervous system is like an alarm system, that we want our alarm system to work when somebody tries to open our window or kick in our door, but we don't want our alarm system to go off when a leaf blows by, right? So our nervous system can become sensitive over time when we've been in pain for several months or years. And so absolutely, I hope that answers your question. Pain is real. Yes, 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 yes. Okay, sorry, I'm reading a chat and it's like, exactly. So pain is real. If you experience pain and somebody has told you otherwise, that your pain is not real, it is real, okay? What they are probably talking about is pain is complex and they can't put their finger on it. And the other question I see out there, are there extra challenges in practicing mindfulness for those with ADD? Yes, but it can also be beneficial. And in my experience, what I have found, by no means is this my specialty in treating ADD, but I've had many patients come to me in physical therapy that also that say have back pain, but you also have ADD. Where I would start there is it can be tricky to sit still and breathe. And so really in that case, it would be, I would have people start with really gentle movement along with their breath when we talked about mindful movement, and allowing your body to move a bit with your breath and starting to soothe your nervous system in that way, what we call more like a somatic experience in experiencing mindfulness with movement. And then as the nervous system starts to learn how to soothe itself a little bit more, then it might be a little bit more accessible for you to sit still in a meditation. I hope that answers your question. Let's see. I think I can do. I have a patient
I
coming.
think I'm going to cut you off, Michelle.
Yes, I could go all day.
We're pressed for time now. Thank you everybody for joining today's webinar with Michelle, and I hope you learned something. And like she said, the contact information is down below. Give us a call or schedule yourself online to come and see Michelle or one of our other amazing providers here at Heart of Wellness.
Yes.
Thank you everybody for your time. I hope you have a wonderful rest of your day.
Can I say one more thing?
Go ahead.
Okay, so those of you who are signed up, that signed up for this today, I may be doing another one of these in the future, maybe early next year. And it is my hope to create a class series around this topic. So just stay tuned. You may receive an email down the road that talks about that, so that you would be, if you are not looking to come to physical therapy right now in this moment, I will hopefully be creating a series around this down the road. But for now, like Riley said, you know where to find us. All right. Thank you so much for joining me today. Have a wonderful day.